billion a year in terms of what the equivalent would be if you had to pay for that service. What makes these caregivers different, I'll just mention a couple of things that makes them different. They're pretty much equally male and female, which it's generally more of a 60% women, 40% men when you do caregiving research in general. So they're somewhat more, they're pretty much equal. A higher percentage are living in the same household or nearby. That's within 20 minutes of the person. 72% total are living either in the same household or nearby. That's different from caregiving in general, where people tend to be more living much further away than that. 2/3 of these caregivers, these technology caregivers, say that they visit their family, this family member, at least once a week. And I can tell you that that's many times higher than in caregiving in general. And 86% of them are providing at least one activity of living, ADL, activity of daily living, which is personal care, bathing, dressing, feeding, toileting, transferring from the bath to the chair or the bed to the chair. They're very intensive personal care activities that they're doing. So that also means that they're experiencing a higher burden of care. So what we did was we gave them 12 technologies to use, to look at, or not to look at, to read about. Unfortunately, they couldn't look at them, even though all of these are technologies that actually exist or are in some form that's very similar that could easily be adapted to family caregiving. So we gave them these 12 technologies, and we asked them, if somebody were to provide this free, do you think this would be something that you would use? And then we went back and we asked them, what do you think about how helpful this would be for you as a caregiver if you had to pay a nominal charge for it? Because we wanted to get not just, how much is it, we'd love to have it, yeah, we think everything is great, but then we also wanted to look at barriers. So just briefly, the 3 technologies of the 12 that came up as most especially helpful for these caregivers were personal health records tracking. It's kind of like the Microsoft eHealth Vault, although we didn't name that. Caregiving coordination system. That is something that really allowed the caregiver an electronic log for doctor's appointments and caregiving tasks that the family and friends could all feed into together. They could use it as a scheduling device, and you could also use it as a system to request a volunteer if you wanted. And then the last thing was a medication support system. So, and that's also something that Dr. Migliori mentioned, that a medication support system would be something that would provide medications and maybe give you information, a little bit information about tracking if you were the family caregiver, as well about how your loved one is taking the medication over time and if there are counterindications. So when we also went on then to look, we could go over at the Q&A about what some of the other technologies were, and certainly they're available in the full survey. We can see also that when we asked about usefulness of technologies, almost 70% of them said that they would be responsive to the idea of having smartphone apps. And we also know that almost 90% of these technology caregivers had high-speed internet at home, and 75% of them said they had some kind of a mobile device with with browsing capability. So we asked them, what do you see as the things that you think you would want most out of devices? What are the benefits, the things that you would value? Saving time for me as a caregiver was number 1. Improving the logistics of what I have to deal with as a caregiver is number 2. Increase my perceived effectiveness as a family caregiver. And then also reducing stress. So those were the ones that came in really as number 1. We did do a little breakout of long-distance caregivers, and you can see that they saw something that would make them feel more effective was really something that was very high. And I'll just mention that due to the economy, another study that we did actually with UnitedHealthcare is looking at is long-distance caregiving increasing or decreasing? And because of the economy, it was decreasing. More families were moving in together. So we asked them about what do you see as the perceived barriers of this technology. Not surprising, they said too expensive. They thought it was too expensive. This is when they didn't even know how much it was. So they just said, I think whatever that is, it would be too expensive. But conversely, a lot of them said they thought it would save them money. It would save money over time. Big deal was technology did not address need, and we've heard that. For those of you who've been here since this morning, we've heard that repeatedly. Technology didn't address their need. And also a big deal, the next biggest deal, was that the care recipient would resist. This is not something I'd be able to talk my family member into. They said they thought they would be more likely to try a technology if a healthcare professional who's involved with either me as the caregiver or the care recipient explained the technology. And actually, that was something the second panel this morning talked about, too, the idea of having someone who is a trusted healthcare professional. And then also a how-to explanation showing how to install and use. And the Best Buy guy this morning had said that the feedback they have is baby boomers are intimidated by the technology and they want us to explain it so we can understand it. So that's exactly what we were hearing here. And then the next highest thing was people saying that they'd really like to have 3-year warranties. So I realize now we can't turn down the lights, and so it's going to be kind of difficult for you to see this. All the more reason to actually look at the study. But this is a really interesting chart, I thought, that shows on the left-hand side, we've got, and I'm having trouble reading it too, on the left-hand side, we've got the greatest potential of the technology, and then on the right is only moderate potential. And then the access on the left is helpfulness. The access across the bottom is barriers. So when you graphed out the technologies, you see, again, the ones that I talked about, the 3 that came up number 1, are right there in the upper left-hand quadrant. And then you can see that some of these others, they were viewed as probably being pretty good in terms of helpfulness, but there were barriers for some reason. And then it goes down to, all the way down to, in the lower right-hand side, caregiving coaching software, transportation display, or caregiver mentor matching service. So who was the most receptive to these in the caregivers? Caregivers under 50. I don't think that really should come as a surprise to anybody. Early adapters is another group, the people who say that they want to be in the forefront. And then I mentioned burden of care earlier. That's a combination of hours that you spend and intensity of tasks. And the people with the highest burden of care, they said they were among the ones who would be most receptive to this technology. And so the other thing is, when we looked at trusted resources, the ones that came out number 1 were medical sites like WebMD or the MayoClinic.com, or government websites like Medicare.gov. So what are some of the implications that we had in this study? Well, one thing is the need for education, because as I mentioned, some of these technologies cost little or nothing. For example, personal health records really isn't going to cost the consumer anything, even though they were perceived as being too expensive. And secondly, use involved healthcare professionals to help overcome resistance, and this is on the part of both the caregiver and the care recipient. And this is something that was said loud and clear several panels in this segment today. Technology must be easy to use and clearly needed. And also we saw that people were open to smartphones, to using smartphones in the future as a way of having mobile apps. So I wanted to just thank UnitedHealthcare and also our advisors on the study, which include Lori Orloff here, Maj Alwan, who is the head of CAS, the Center for Aging